Tony O'Brien, Director General of the HSE. This is your second service plan and the first for your newly established directorate. To begin with, what are your key priorities for 2014?
I think the major priority has to be to ensure that quality and patient safety are at the centre of the service plan. That's particularly important in light of the enormous changes that the health service has been through in recent years. And secondly, to stabilise our health service provision, to make sure that the things we're doing we can do well and not to add in too much that could put further strain on our services.
You've been given a savings target by government of 666 million to achieve this year. This amounts to nearly 4 billion in cuts over the last 4 years. Is 666 million achievable?
Well, fortunately it's been reduced to 619, which is still a very big figure. It's going to be difficult, it's going to be challenging, but ultimately yes, it's achievable provided we all pull together and do the things that we need to do.
Can you broadly describe the main envelopes from which you're going to draw in order to achieve the 619 million?
Well, most of them are going to be in the PCRS, which is the primary care reimbursement service. There are going to be co-payments of an increased nature for prescription charges and so on. We're also going to rely very heavily on the provisions of the Haddington Road Agreement, the extra flexibility, the additional hours, the changed rostering approach. And in addition to that, we have some specific measures to do with the probity scheme that we will talk about.
Now, the next question, there are lots of areas I could ask you about, but in the following service areas, can you describe how your plan is going to affect, let's say, for example, the disability sector?
Well, the disability sector is going to have some new investment. We're specifically going to target 0 to 18s with some additional access issues. We're going to make sure we have adequate provision for school leavers, which has been a recurrent problem over the years, but we're also going to require the disability sector to provide 5 million in value for money savings. We're going to be working with them to ensure that many of their back office functions are more efficient than they otherwise would be, and that in general they're operating in the most efficient way possible.
Is it likely to affect frontline services in disability?
No, the whole aim of the purpose is to ensure that we don't affect frontline services and that a greater proportion of the total resources are used to provide services to our patients and clients.
Just moving on then, acute hospitals.
Acute hospitals have been challenged over a number of years. This year we're seeking to sustain the overall level of funding, but requiring hospitals to deliver on some of the cost containment plans that they failed to deliver on in 2013. That having been said, there's a strong focus on access and, as with other services, a particular focus on quality, so we'll be looking to address some of the issues learned from the Galway maternity report, for example.
And what about mental health?
Mental health this year will be the beneficiary of a 20 million ring-fenced investment, which will provide...
That not supposed to be in 35 million?
Yes, the intention was that there would be 35 million over 3 years. There's been 2 years of 35 million. This year there's to be 20 million and then 15 in the following year, so it's been spread out slightly. But again, there'll be between 250 and 280 new posts intended to be recruited by year end, with the follow through on some of the posts that are outstanding from previous years. So that moves us some distance along the way towards full implementation of Vision for Change.
Our ambulance service has received quite an amount of coverage over the last year. What is happening with the ambulance services in this service plan?
One of the key issues is to complete the centralisation to just 2 control centres, and there's funding available for that in this service plan.
Moving on then to Fair Deal.
Well, Fair Deal, we're looking to take 23 million euros from Fair Deal to put into other forms of support for older people, specifically to ensure that we can keep a balance between those who need long-term care and those who would actually prefer to be properly supported to be independently living in their own homes. So this will allow us to provide for 1,000 people to have highly intensive supports to enable them to continue living the style of life that they would wish in their own home, rather than having long-term institutional care be their first choice.
Medical cards obviously has been top of the agenda for the last number of months, and a figure of 113 has been mentioned. Does that 113 figure still apply in relation to medical cards?
No, we were I think all collectively very troubled by the notion that 113 million euros could be achieved through probity measures. It was never real in our view. Through discussion that has now been eliminated. We've received some additional funding, in fact from the Department of Social Protection, to offset part of the cost, and the rest we're having to do some other things like take a different view on how much we need to provide for pension lump sums and so on. But the 113 is gone. We will simply continue with the baseline ordinary level of probity to ensure that we're not providing medical cards to those who don't need them, while at the same time ensuring that those who do need them can get them, and also that some of our service providers are being appropriately paid.
So offsetting medical cards, that 113 against pension lump sums, should staff be concerned about that?
No, there's no risk to the pension lump sums payable to individual staff. The risk is that our budget may be overrun. but we have a process in place designed to address that issue with other government departments. And if there is a fundamental issue with the overall level of provision, then we'll have to address that in due course. But no one should be concerned about their individual lump sum. That will still be provided.
Very good. I'm sure staff are always one of the things in their minds will be service developments and new things we can expect to see in 2014. Is any of that included in the plan?
There is about €300 million for new service developments. We've touched on mental health already. There's also the 0 to 6s GP visit card. In addition, we'll be providing this year for the bilateral cochlear implant programme. We'll also be providing funding for such things as home care packages for babies who would otherwise have to remain in hospital longer than they should. We'll be continuing the development of the diabetic retinopathy screening programme with bowel screening and other investments such as in hemato-oncology and oncology services. So there's a good range of services, all of which are spelled out in the service plan at Appendix 1.
And obviously this is the first service plan that is signed off by the new directorate, and there are many changes and reforms going down the track in relation to health services. Do you want to just briefly comment on that?
I think one of the most positive things is that the Minister has given the HSE itself a mandate to make the administrative changes necessary to reorganise the service. So rather than this happening as a sudden big bang event, we'll have the opportunity to manage that internally ourselves. We'll be taking forward the Patient Safety Agency on an administrative basis, progressing with the hospital groups leading to trusts, advancing the community and social care organisation of our services with new organisational structures coming on stream next year. So a range of things, including Money Follows the Patient, that the HSE itself will be managing as we move towards this new purchaser-provider split, which ultimately will mean that the HSE as we know it will of course no longer exist.
And do you think when we're talking this time next year that we'll see a whole differently structured HSE and a whole differently structured delivery system?
I think the legal framework will be much the same, but the way we do business will have changed quite considerably, and I think that will be to everyone's benefit.
So coming up towards the end of 2013 has been a very difficult 4 years for staff, I think you would agree. Have you any particular message for staff at this time of the year?
Well, I think the first thing is to thank staff for the enormous contribution they've made in the last 4 years, which has enabled the health service not only to survive, but in many ways to improve in this very challenging time. I wish I could say, and can't say, that next year would be easier. It's going to be a difficult and challenging year, but I am convinced that with the ongoing commitment and dedication of our 100,000 colleagues throughout the health services, that we can get through the next year, that we can improve health services and can ensure that quality is absolutely at the centre of all that we do. So I'd like to leave on that point by wishing all my colleagues, given the time of year, a happy Christmas and a successful new year despite the challenges that lie ahead.
Mr. Tony O'Brien, DG of the HSE, thank you very much.